Gradual, undetectable symptoms of high blood sugar can sneak up on you. The characteristic symptoms of type 2 diabetes, frequent urination, and increased thirst are sometimes minor and readily explained by other circumstances. In fact, until they are given a type 2 diabetes diagnosis, the majority of people aren't even aware that they have high blood sugar. Diabetes is a chronic disease that raises the body's glucose, or sugar, levels. The issue is that ignoring or dismissing the symptoms as anything else may ultimately result in more severe health issues. Diabetes, if ignored, can cause kidney and nerve damage, heart disease, a stroke, eyesight loss, and other problems. You can harm your organs even if your blood sugar levels are mildly elevated. Number 10. Frequent urination. Frequent urination is a common symptom of diabetes, particularly in uncontrolled or poorly managed cases. High blood sugar is indicated by frequent bathroom visits, particularly at night. The kidneys must work harder to eliminate extra sugar from the blood when you have diabetes. Your kidneys spill extra sugar into your urine when they can't keep up, which makes you urinate more frequently. If you're experiencing frequent urination and suspect it may be related to diabetes, it's important to consult with a healthcare professional for a proper evaluation and diagnosis. They can perform blood tests to measure your blood sugar levels and assess your overall diabetes management. Proper management of diabetes through lifestyle changes, medication, and insulin therapy, if necessary, can help alleviate the symptom of frequent urination. Number 9. Repeat infections. Diabetics are prone to various types of infections, including urinary tract infections, skin infections, such as cellulitis and boils, fungal infections, such as oral thrush and vaginal yeast infections, and respiratory infections. In severe cases, they may also be at higher risk for more serious infections, such as pneumonia or bloodstream infections. Your urine's excess sugar provides yeast and bacteria with sustenance. They prosper when given food and a warm, moist environment. Therefore, people with diabetes frequently have yeast or urinary tract infections, especially women. Number 8. Excessive thirst. Frequent urination can cause dehydration, and you will feel thirsty more often. But drinking more doesn't satisfy the thirst. Frequent urination causes the body to lose more water, leading to dehydration. Dehydration, in turn, stimulates the thirst mechanism to encourage increased fluid intake and maintain proper hydration. Number 7. Constant hunger. Constant hunger, also known as excessive or unrelenting hunger, can be a concerning symptom that may have various underlying causes. Your body transforms the food you eat into glucose, which is then used as energy by your cells. However, diabetes prevents the cells from properly absorbing glucose, which prevents your body from getting enough energy from the food you eat. As a result, even after eating, your body is always searching for food, which causes constant hunger. Number 6. Unexplained weight loss. A sudden decrease in appetite or changes in eating patterns can lead to weight loss. This can be due to stress, emotional issues, or other factors affecting your appetite. If your body can't get enough energy from your food, it will start burning muscle and fat stores instead. So you may lose weight even if your diet hasn't changed. Number 5. Persistent fatigue and weakness. Persistent fatigue and weakness are common symptoms experienced by individuals with diabetes. Diabetes is a chronic condition that affects the body's ability to regulate blood sugar levels, and your everyday tasks may be hampered by continuous exhaustion and weakness if you don't consume enough fuel for energy. The continuous urination that results in dehydration can make you feel worn out as well. Number 4. Poor vision. Poor vision is a common complication associated with diabetes and is known as diabetic retinopathy. It occurs when high blood sugar levels damage the blood vessels in the retina, the light-sensitive tissue at the back of the eye. You may suffer hazy vision in one or both of your eyes as a result of high blood sugar, which can harm the blood vessels in your eyes. Permanent harm could develop if unattended to, which could result in more severe problems and even blindness. Number 3. Slowly healing cuts and wounds. Slow healing of cuts and wounds is a common problem among individuals with diabetes. High blood sugar levels can damage blood vessels and impair circulation. Reduced blood flow to the injured area means fewer nutrients and oxygen are delivered, slowing down the healing process. Blood circulation can be hampered by high blood sugar, which can harm blood vessels and neurons. Insufficient blood flow prevents cuts and wounds from receiving the nutrients and oxygen they need to heal properly. As a result, healing may take weeks or even months, which raises your chance of developing an infection. Elevated blood sugar levels can impair blood flow and damage blood vessels, affecting the delivery of oxygen and nutrients to the wound site. Keeping blood sugar levels well controlled is crucial for promoting healing. Diabetes-related neuropathy, nerve damage, can reduce sensation in the affected area, making it harder to notice injuries and wounds. Regularly inspect your body for any cuts or wounds, especially in areas that are prone to damage, such as the feet. People with diabetes are more susceptible to infections. If you have a cut or wound, it's important to keep it clean and properly bandaged to reduce the risk of infection. Consult your healthcare provider for appropriate wound care instructions. Peripheral artery disease, PAD. Diabetes can contribute to the development of peripheral artery disease, which affects blood flow to the extremities. Poor circulation can further impede the healing process. Managing diabetes, maintaining a healthy lifestyle, and addressing underlying vascular issues can help improve blood flow. Proper wound care is essential for healing. Clean the wound gently with mild soap and water, and apply an appropriate antibacterial ointment or dressing as advised by your healthcare provider. Avoid harsh chemicals or antiseptics that may delay healing. If you have a wound on your foot or leg, reducing pressure on the affected area can aid healing. Use cushioned footwear and avoid standing or walking for long periods. If necessary, your healthcare provider may suggest offloading devices or custom orthotics. Maintain a healthy lifestyle to support healing. This includes eating a balanced diet rich in nutrients, staying hydrated, getting regular exercise, as advised by your healthcare provider, managing stress, and avoiding smoking or excessive alcohol consumption. Remember, every person's situation is unique, and it's essential to consult with your healthcare provider for personalized advice and guidance on wound care, managing diabetes, and promoting healing. Number 2. Tingling or numbness. Tingling or numbness in the extremities, such as the hands, feet, or legs, is a common symptom experienced by individuals with diabetes. This condition is known as diabetic neuropathy and occurs due to nerve damage caused by high blood sugar levels over time. Poor blood circulation and nerve damage can cause tingling, numbness, or pain in your hands and feet. The tingling sensation, also known as paresthesia, is often described as a pins and needles feeling. Numbness refers to a loss of sensation in the affected area. These symptoms may be accompanied by pain or a burning sensation. If you're experiencing tingling and numbness in your extremities and you have diabetes, it's essential to consult with your healthcare provider for a proper diagnosis and management. They may perform a physical examination and order tests such as nerve conduction studies or electromyography to evaluate the extent of nerve damage. Managing diabetic neuropathy typically involves controlling blood sugar levels as well as addressing any underlying conditions contributing to nerve damage. Number 1. Dark skin patches. Dark skin patches in diabetics can be a symptom of a condition known as acanthosis nigricans. Acanthosis nigricans is characterized by thickened, dark, velvety patches of skin that typically develop in body folds and creases, such as the neck, armpits, groin, and sometimes the hands or feet. Diabetes can cause dark, velvety patches of skin in the folds of your neck, armpits, or groin due to an excess of insulin in the blood. Dark skin patches in diabetes can also be a symptom of a condition called diabetic dermopathy or diabetic skin complications. Diabetic dermopathy is a relatively common skin condition that occurs in people with diabetes, particularly those with poorly controlled blood sugar levels over a long period of time. It is more common in older adults. The exact cause of diabetic dermopathy is not fully understood, but it is believed to be related to changes in blood vessels and small vessel disease associated with diabetes. The condition manifests as small, round, or oval patches of light brown to dark brown skin, typically on the lower legs. These patches may be slightly raised and have a scaly or shiny appearance. Did you like it? Tell us what you think of the video in the comments section below, and don't forget to subscribe to our YouTube channel for more interesting videos.